Hey, Will.
Hey, Doc.
How's it going?
Good, good.
What's happening?
No, nothing much. Just here early, about 20 minutes waiting for my appointment, so.
Oh, just hop in, let's have a chat.
Yeah, you got it. Sure. Great. Well, thanks for letting me get in the car for a minute.
Oh, absolutely. So how are things?
So far, so good. It's been a fun week. Definitely do normal chemotherapy. Coming here to get some information. But for the most part, everything's been good. My son having great time in summer camp, and my wife, working remotely, but slowly getting back to work. So not too bad.
That's awesome.
Yeah.
Getting a little bit back to what normalcy
Right.
resembles, I guess.
Yeah.
So, tell me about this. How did you get to City of Hope? How's your experience so far? We could start. What your experience has been, and how did it start?
Honestly, it started a little bit randomly. When I first got diagnosed with cancer, I was on a different healthcare plan, and so it put me into a specific area. And when I went to meet the oncologist the first time, the information that I was given was very disheartening. Pretty much, I was given a 3-month survival rate. I had stage 4 colon and liver cancer, so it was more like, we wanted to comfort you, and we're going to do the best we can to make you feel comfortable over this amount of time. And that was not the answer I wanted to hear. I was like, okay, well, that doesn't sound like my plan. So I ended up working with my wife and my work, and we switched my healthcare provider, and were able to get moved to the City of Hope. And I was able to go to the Duarte location, and from there I met a lot of great doctors who actually had different opinions and provided different answers to help me with my treatment. And that was almost 6 years ago. So I went from 3 months to now living 6 years, and so that was a big movement.
I think that's such an impact. That's
Oh, yeah.
so good to hear that you go from what you heard at first.
Yeah.
To, what actually the outcome has been so far.
Yeah.
And how well you've done.
Yeah.
Really. That's so good to hear. Okay. This is interesting.
This is the
Maybe
natural.
I should take this
I was
one
gonna say
off.
this. Hey, Doc, you want to hear some music? Just like, boom. Hey, Doc, you want to hear some music?
Oh yeah.
All right. Don't worry, it builds. Ready?
I think part of this comes from the compassion. We talk about compassion and care, and how we want to actually drive this and try to apply the science as well as we can.
Yeah.
But also at the same time look at the patient as a whole.
Yeah.
It's you can't just treat the disease, and I think that's one thing that has been apparent to me with the doctors, with City of Hope.
Oh yeah, no, totally. I honestly think that the caring and compassion that the nurses have given me, the doctors, above and beyond. I've had multiple surgeries, and I've had a couple nurses sit in the room and just talk with me, and that made me feel great. And then on top of that, not feeling like a number is probably the most important. They know my name. The doctors take time. They actually talk to me about things that they remember that we've talked about before. So it's not just hey, I looked at your chart. Okay, sounds good. I'm going to pass you on to somebody else. It's more about who you are, how you're doing. And honestly, that does take a big role in how we recover. And optimistically, that's really changed a lot of my outcome, I think, for the most part.
Yeah, so I wanted to just chat with you a little bit about your, experience that you've had with the City of Hope. We'll
Sure.
talk a little bit maybe about the commute and how things are going. Did you know that before we opened the center here, about 20% of people in Orange County who were diagnosed with cancer would drive out of the county to seek medical care?
Yes, I kind of would be one of those people. Yeah.
Yeah, so I think I would love to hear what you have to say about the commute issue, because I think it's a big deal when you have to get treatment. It takes you a couple of hours in traffic to go and come back. You have to do it weekly. I think that's difficult.
It is. It takes a toll, not just on your personal life, your work life, other things that you have to juggle. But getting to a farther location, having to drive over an hour, maybe two, depending on where you live, get treatment there, and maybe same day still have to drive home. So you're taking time from someone else's work to drive you if it's harder chemo, and if it is lighter chemo and you're driving yourself home, it's probably not the best decision, to be in the car for that long period of time. But I definitely think that having closer treatments, having closer areas where people can get that kind of provided healthcare is necessary, because driving that long is just not good for anybody.
Well, I mean, studies show that when you have a better functionality, it's better mental health when you're able to get the treatment in your own area. That helps the clinical outcome too when we do the treatment, because you just feel more comfortable.
Oh yeah, no, 100%. I honestly, I think it takes a lot of stress off your shoulders. I know having a closer area like this has really made it a lot easier for me. I feel that I get a lot more rest. I can plan my day a little bit better. But then on top of that too, I don't have that stress of having to think, am I going to sit in traffic? Do I have to plan 2 or 3 hours ahead? Is my whole day washed away? All of that is kind of gone, knowing that I'm a little bit closer.
Yeah, the traffic of Southern California.
Yeah, very much.
You can definitely say that.
Hey, Summer.
Hi.
Hello.
Hi, guys.
Hello.
Hi.
Hi, Dr. Karimi.
Hi. How are you?
Good. How are you doing?
Pretty good.
Try to extend that a little bit more.
Yeah, that was good.
Why is there glitter in the car? I was just like, what is going on in this place?
How about a joke?
Yeah, let's hear it.
Knock, knock.
Who's there?
Sarah.
Sarah who?
Sarah, doctor in the house?
I don't know, is there? Okay, that's nice.
I don't know if you know the history of City of Hope, that it actually it started more than 100 years ago as a tuberculosis center.
Oh, wow.
And
Okay.
that just shows you what the culture is, what the culture has developed over the years.
Yeah.
Tuberculosis center, eventually, taking care of people who, it's a crisis. It was a crisis. And just has always been in the front, leading to take on crises that come up. I mean, even with COVID, we actually are testing a COVID vaccine right now.
That's cool.
Yeah, so, it's, and then obviously treatment of cancer, all the scientists that are involved. It's a nationally known scientists, clinicians who are, in development of clinical trials, developing new drugs that are being used now over the last, several decades.
That's
so,
awesome.
it all, I think, meshes together, that it's, you start from a culture that was about the patients with not so much science. Tuberculosis, we didn't really have that much science, right?
Yeah.
And so you start with that and you look at a person as a whole, and then you eventually develop it into, with the compassion, you also look at the science and you try to put the best of the two together.
Yeah.
And I think that's where the reputation of City of Hope comes from.
Yeah.
And that's actually how I got into City of Hope. I had heard about the reputation. I was coming back to Southern California and started looking at that and decided to join. And over the next few years, I just saw that it was really true. It's how we take care of the patients. You as an example, and I've had a few that actually have been told, well, it's going to end up really bad in the next few months.
Yeah.
And a different direction, and here you are, obviously very active. You don't have time to do anything. I mean, between the work and the family, which is awesome. That's exactly what we want to see, and that's how it got me really into it. And I've really enjoyed the time I've had, with the organization, because of the amount of basically compassion that we have, what we put into making sure that it's about patients.
Yeah.
It's patient centric, and then we try to bring the science in and combine the discovery and the science together.
I think it's awesome that the first thing that you guys do is work together in panels to come to conclusions like, hey, let's just try this, let's give it a whirl, versus saying, it's not going to work, or let's not do this. And I think it's not about shutting people down, it's about helping them discover new ways of survival. And I think that's what it is. So,
And what's amazing is we started a lot of times when you have advanced disease, we say, well, surgery is not an option.
mm-hmm.
And now we have, like you mentioned, we have these tumor boards that we get together. We have the surgeon, we have the radiation oncologist, we have medical oncologists, we have pathologists, we have interventional radiologists, everybody in looking at scans, looking at the history, and everybody has an input. And a lot of times, even for advanced disease, we end up providing surgical options,
Yeah.
going after, limited disease here and there, and that really changes the outcome.
100%.
Yeah, so
Yeah.
I think that's been really helpful. The other thing that I wanted to mention is, it's obviously a part of it is the science behind this with all the scientists. The other part is the taking care of the patients. We also have other disciplines. We have clinical trials that we're bringing to Orange County. So we're going to be able to share the trials that we have available
That's
at
awesome.
Duarte with Orange County.
That's huge.
So that's another one. We also have a screening program. So looking at lung cancer screening. We have
Oh, wow.
a
Okay.
full active program. We also have actually proven methods at looking at prevention, like smoking cessation.
Oh, okay.
Those are also the other aspects that we're working on. We have palliative care, so basically making sure again patients are looked at as a whole, family centric, and we're developing that I think is going to be the best program in Orange County. But of course, I may be biased, but really looking at all those aspects. So
Yeah.
I'm really excited that. Even though we started in Orange County really last year,
Yes.
I think we have a lot to accomplish, and we have the means to do that.
I think that's awesome. And I got lucky because I actually started pretty much, I think it was like 1 or 2 months after you guys opened the location. And so I literally
remember.
was like, this is awesome. And for me specifically, because again, driving over an hour just to get the service I, was accustomed to, and come here and get that same service, get that same quality, get that same care, and now knowing that you have even more that's going to be coming, I think that's amazing. That's
Yeah.
going to be so much helpful.
So I think it's been unbelievable. Okay,
That's a keeper, by the way.
I can't see anything.
Right on cue. I was like,
Okay.
that was 35 seconds.
this,
That was 35 seconds of you dancing. That was good. I was like, why else would you invite me into a car other than karaoke? I was like, where did the glitter come from?